Governor Newsom is now giving a coronavirus update. Let's listen in.
In the state of California that are being disproportionately impacted by the spread of COVID-19. We've talked a lot over the course of the last number of weeks, months, about the importance we place on personal responsibility to wear face coverings, to wear face masks, the concern that has been expressed by many, certainly not just those representing the state of California, but all across the country, that so often we let our guard down, that we may be mixing outside of our households, either in large congregate events or even in your own backyard, where extended family members come over. We may begin by wearing our face coverings, but within an hour or two, as we get to the cooler to have a drink and eat some food, the masks now are put aside, the kids start congregating, and we put ourselves in a position where it's more, not less likely, that we'll see an increase in the spread, in the transmission of the virus. Multi-generational households in particular are vulnerable, particularly from an age cohort perspective, to the ravages of this virus in those types of environments. We've talked a lot about the challenges in congregate facilities, congregate settings, from homeless shelters to skilled nursing facilities, residential care, adult daycare facilities throughout the state of California, and clearly in our corrections institution, not only at the state level, but at the county level as well. Not enough focus, candidly, has been placed on essential workers in this state. And for us to be able to be successful in terms of stopping the spread of COVID-19, extinguishing COVID-19, which we will do, it depends on our ability to keep our essential workers safe. Who are these essential workers? This slide, I think, is profoundly important. And I hope you'll take a good look at it. Those that may be listening that don't have the benefit of the slide we're putting up, it's self-evident to many people that we demanded, even with our stay-at-home order, certain sectors of our economy to remain open. We deemed them essential. Grocery stores, food delivery, truck driving, warehousing, logistics, the foundational principles of any free society, the foundational needs that we all have in terms of basic health needs, basic food and shelter needs. So we relied on millions and millions of essential workers. That's even with the stay-at-home order. What wasn't identified as, I think, acutely as it needs to be identified is not only the sacrifices of those workers, and we've made a point of trying to do more to support our essential workforce in the past as it relates to providing support, a number of things that I'll be talking about here today. But we didn't get under the hood to state the obvious, and that is overwhelming majority, you'll see in certain sectors of our economy, are disproportionately represented in the Latino community, in the Black and Asian community. Look at farm workers. That may not surprise many people, 93% of that workforce being the Latinx Latino community. But look at construction laborers. Look at the cooks and the food preparation workers. Look at our critical workforce, our truck drivers and cashiers. Over half of the cashiers in the state are represented in the Latino demographic. And that's the community that increasingly and disproportionately is being impacted, not only by the spread of the virus, but the mortality related to the spread of the virus. It's not exclusive. Again, I'm not suggesting by any stretch it's just exclusive to one segment of our society. It crosses all segments of society, essential workers. But it is disproportionate. And so when people ask, as they often do, where are we seeing the spread? This is where we're seeing the spread. Essential workforce disproportionately represented by the Latino, Latinx community. And that slide, I think, only reinforces and underscores the imperative of us to increase and build on the work we've done, increase the effort, and target our acuity of focus in terms of protecting these essential workers that we have foundationally come to rely on, even as we pull back some of the modifications we made at stay-at-home order, this essential workforce remains the bedrock, the backbone of those that are providing foundational, fundamental services to the state of California. So here's what we're announcing today is additional worker safeguards to protect the workforce, to focus again always on preventative measures, to focus on helping support our employers that have been overwhelmingly, have been over some of the modifications we made at stay-at-home order. This essential workforce remains the bedrock, the backbone of those that are providing foundational, fundamental services to the state of California. So here's what we're announcing today is additional worker safeguards to protect this workforce, to focus again always on preventative measures, to focus on helping support our employers that have been overwhelmingly, have been overwhelmingly supportive of these efforts, and we want to continue to work in the spirit of collaboration and partnership with our employer community to educate not only employers large and small, but to help them educate employees as well. And we want to extend some longer-lasting workers' protections. I referenced a moment ago some of the previous work we had done to support our essential workers. We want to build on some of that previous work. A lot were done with executive orders. A lot were done building on the CARES Act and what has come from the federal government. A lot of those things, as you're very familiar, including unemployment insurance, has expiration dates, which has put more acuity of focus on this time of the year, meaning end of July, where a lot of these things are expiring into August, September, where other extended supports are also expiring, and the need to re-engage in a more vigorous conversation, at least here in the state with our California legislature, the federal government, clearly with Congress and the White House. Let's talk about the preventative measures. Foundationally, the most important thing we can do is if someone is sick or feeling sick or has been exposed to the virus, we've got to give them the supports where they have the ability to isolate, the ability in some cases to quarantine. That may be easy in certain segments of society, certain cohorts that have the resources, maybe have the space, household space, may have the capacity to, go to a second home in maybe one instance, or even to expand part of their personal property and segment it off from other members' families. Others are stacked on top of each other, 3, 4 people living in some cases quite literally in the same rooms. I'll never forget a family in San Francisco I visited at a single-room occupancy hotel in the Tenderloin. Went into the room, and there were only beds on the floor. There was no space that wasn't filled with a bed. There was literally 8 people living in less than 100 square feet, stacked up quite literally on top and next to each other. And the like, we want to expand that. We talked a lot about Project Room Key, point of pride as it relates to the work we've done for homeless. We want to build on the Room Key model, and we want to extend it to those that may need that support to be isolated and quarantined. So we're opening up a portfolio and identifying additional assets within that portfolio to provide expanded opportunities in that space, more resources in that space. Accordingly, we focus on that chart a moment ago on terms of agricultural workers. We have to do more to support some 626,000 crop workers that come into the state and live here year-round in the state of California. 626,000 crop workers in the state. You have a lot of temporary housing as relates to the seasonal workforce. Done a lot down in Monterey, increasingly now not just on the California Central Coast, but now in California Central Valley. That chart a moment ago on terms of agricultural workers. We have to do more to support some 626,000 crop workers that come into the state and live here year-round in the state of California. 626,000 crop workers in the state. You have a lot of temporary housing as relates to the seasonal workforce. Done a lot down in Monterey, increasingly now not just on the California Central Coast, but now in California Central Valley. We need to do more for our agricultural and farm workers. And so we have a housing and harvest partnership that demonstrably led by providing facilities, providing access to quarantine and isolate individual farm workers in Monterey. We're going to build on that. They've done an incredible job in this state supporting ag workers and farm workers, agricultural workforce and farm workers. I want to thank the ag industry. They've been very supportive of that program, and we're going to expand access to that program and provide more supports, particularly in the Central Valley, not just the Central Coast in the state of California. And that's something else we'll be doing. And I can't press upon you more. When you go to the grocery store and you have the abundance that doesn't exist in almost any other part of the globe at the scale and scope it does here in a dense urban setting, at least a remarkable place we call home here, California. You go to that store and you see that abundance, don't forget the folks that made sure to make that abundance available to you. And we have to make sure that we have an abundant mindset in terms of helping support these workers and make sure that they're safe, they're healthy, because of the essential nature of their incredible contribution to the state and our nation. Accordingly, we need to build a public awareness campaign. We've done a lot with our mask campaign. We've done a lot of PSA campaigns in the past, going back many, many months, significantly increased our digital, radio, and television ads. You may be seeing some of them up related to masks. Now we want to increase that campaign to reach more employers, workers, as well as families. A Know Your Rights campaign, basically educate individuals about guidelines, about what we've been putting out in terms of sectors and how to keep people healthy and safe. If I reflect back with objectivity, and I often do this, one must, because you can't be ideological about any of these endeavors. When we began to reopen our economy, we focused so much on when, but we didn't focus enough on how to not only do it, but to educate individuals, not just the sectors in our economy, the business owners in our economy, but individuals about what those guidelines are. I recognize that, and we have a responsibility to now really call that out and do more in this space. And that's exactly what we'll be doing, building on the existing public awareness campaign, but a whole new scale. We've been talking to legislative leaders about some support. We've obviously generated, and I've made this point on many occasions, a lot of philanthropic support in this effort, as well as federal support in this effort. We're now going to step up those efforts in a much more targeted and a much more focused way. Part of that education, again, as I said, is not just educating families and employees, but also educating our incredible employers just on more details around the guidance we put out. It's one thing to put out guidance. As an employer, I know this intimately. The state may send us a lot of information, but we're dealing with the crisis of the day and, you know, our P&L statements and taxes and fees and this and that and everything else, and now we stack 7, 8, 10 pages of new guidance. It's difficult to get through all that. So we're putting out these new handbooks today that just simplify the guidance, make it easier for our employers to get that information, be able to share that information. We're also looking at best practices, sharing those best practices and the like. I want to thank my Jobs and Economic Recovery Task Force. They've been so instrumental for months helping us work, because it's truly a representative group of business leaders on helping us with the guidance. But they also made a point, which I agreed with, and now we're socializing with you, that we could do more to simplify that handbook, that guidance, and offer more guidance around best practices. And so we are advancing a much more proactive education effort to help businesses comply. It's not about being punitive. It's about educating for compliance, and that includes testing information that we announced a few weeks ago. Dr. Galley announced some new testing criteria in the state. We're moving forward with advancing those, but one of the most critical is the fact that health plans now have responsibility to pick up costs associated with testing for employees, and we want to make sure that becomes more, we want to see that more universal in terms of its application, but we also need to educate folks on some of those new strategies and new opportunities in terms of testing. So that's the purpose of the handbook that we're putting out today, and new tutorials and Q&As that we'll be putting out to build and support the same. So it relates to the efforts to ensure more long-lasting protections. We want to work, as this slide explains, to expand our workers' protections and build on those existing executive orders that I referenced. But here's the difference this time. We have gaps in our paid sick leave in the state of California. I'll give you just 4 examples specifically. Healthcare workers, front line, first responders, those where you have big critical outbreaks, and employers 500 employees or more were not included in the federal supports. That's a gap in the sick leave space. Now, we closed that gap a few weeks ago with our workers' comp and sick leave executive orders, but those are due to expire. We've had great conversations with the legislature, legislative leaders. There's been a number of legislators that have introduced legislation to codify some of what we put out in the executive orders. Others want to go further. Some want to offer their own perspective, and we're very grateful for that leadership. And we've been having some wonderful conversations with the leadership of both the Assembly and the State Senate. And we are committed to a process, have been, and continue to be, and we want to now make this more abundantly clear, more publicly, to move quickly now to strengthen, through this legislative partnership, our paid sick leave, as well as our workers' comp for at-risk workers. Again, we want to open the economy quickly. People that are feeling sick, people that may be sick, we don't want them going to work and infecting other people. Having a big outbreak where now a factory or meat processing plant, fill in the blank, any business has to shut down, bar, restaurant, even if they're doing, or bars closed, but restaurants doing even outdoor dining. If, the chef comes in not feeling well, or the sous chef, dishwasher, whoever, busboys, you want to give them the protection so that you can be protected and customers can be protected. But that's why the workers' comp is so foundational in any economic recovery in the state. And this is truly when we're all in it together, employer, employee, consumers, the public generally. So these are critical in terms of protections for our economic vibrancy, our economic recovery, and for protecting essential workers. And so we're going to be aggressively engaged in an effort and building on some legislation that has been introduced and building on some of the work we already did on the executive orders as it relates to workers' comp and paid sick leave, and filling in those gaps that were not provided by the federal government. We're also going to be a little more strategic. We talk a lot about enforcement. Again, for me, enforcement is not about being punitive, it's about compliance. And I say that because I mean that. This is not ready, fire, aim. It's ready, aim, fire. We want to support people coming into compliance. And at the same time, you got to call out bad actors, people that simply dismiss, don't care for whatever reason, or just don't agree. I respect people's differences of opinion, but when it comes to impacting your health and the health of our economy in the medium and long term, in terms of our ability to reopen by suppressing the transmission of the virus, we have to be a little bit more targeted. And so we're going to be doing some more strategic enforcement of our labor laws, and we've got a series of very specific strategies that we'll be putting out, waiving some of the timelines. Here's the great reality. Here's the mystery to me, may not be for others, but you may not be as familiar with it either, and that is it could take 6+ months to move an enforcement action. Well, 6 months in the midst of a pandemic. How many people can be exposed to this virus? How many people's lives could be quite literally put at risk? So we've got to constrain that timeline. But again, in the spirit of an open hand, not a closed fist, and that's foundational. And so to all the business leaders out there, trust me, I hear you. We're not trying to target enforcement to just be punitive. But we are trying to deal with the time, manner, and place concerns we have around extinguishing this virus as quickly as we can, and the need to go after folks that make some members in certain industries look bad when they may be the exception, certainly not the rule. But we've got to hold some of those folks to a higher level of expectation and cooperation, and to the extent accountability as well. One way we can improve accountability is focusing on strengthening our employer reporting of outbreaks. We're also working with the legislature on this. It is an interesting fact, you don't have a requirement as an employer to connect to your local health officer if you've had an outbreak in your business. Often that comes circuitously, may take some time, there's a delay, and that hurts our efforts to go in and isolate, quarantine, trace those contacts, and potentially help support expansion of testing. So we think that strengthening of employer reporting is also very, very important in this environment as well. So those are the broad strokes of what we are doing to help support our essential workers, what we have done, but building on what we have done, a little more targeted, a little more focused, and certainly in the spirit of our times, spirit of collaboration with the legislature. We look forward to updating you on the progress in all those areas very soon. But speaking of updating, we do on a consistent basis update you on the total case numbers as it relates to COVID-19. We tested over 137,000 people yesterday, close to 138,000 people yesterday. When we conducted those tests, 9,718 individuals tested positive for COVID-19. As I said, while many look to the day-to-day, we tend to look at some of these 7-day averages. That's why we pair the average 7-day 9,881 number with yesterday's report on case numbers 9,718. Let's get under the hood on those numbers, take a look at them. I mentioned we tested close to 138,000 people yesterday. You'll see the average number of tests over the last 7 days, north of 124,000. We will, yes, continue to work to get those testing numbers up. I don't know many states that are testing as many people, but that, as my mom used to say, don't compare yourself to others. So we've got to mark a responsibility as the nation's largest state to do more, and I recognize our responsibility to do more testing. So does Dr. Galley. That's why he announced on multiple occasions our efforts in that space, including, by the way, the encouraging news on testing as it relates to the FDA finally moving on pooled testing. And so we'll be pushing that very, very aggressively. We're working collaboratively with Kaiser and Sutter as healthcare systems who've been incredible partners with our efforts to date. We also have incredible leadership at UCSD and notable leadership at Stanford and UCLA. I want to just make a personal point to thank Governor Gray Davis, who's been a real champion for some of the pooled testing efforts and has had strong relationship that he's been able to coordinate with and provide support of with UCLA in particular. And so you're going to be hearing a lot more about pooled testing. It's something we've talked about in the past. We finally got those approvals from the feds. Some are still pending, but we want to start moving. Quest, as one of our national labs, they're going to be doing most of their pooled testing back east first. But that's not going to delay our efforts as we're going to pursue our own efforts here in the state of California. Dr. Galley will talk a lot more about that. I look forward to talking to you a lot more about that as well. So we're going to be more creative in this space. And then we may have a little bit of surprise related to a new strategy next week related to testing that I'm also looking forward to making public, a new partnership for more innovation in this space. A little preview, an announcement next week. 7-day positivity rate, 7.5%. Monday, when I shared this slide, was 7.4%.